Kidney stones form when dissolved minerals build up inside the kidneys. More than 500,000 people go to the emergency room with kidney stone-related problems every year, and researchers have determined about 1 in 10 people will get a kidney stone during their lifetime. So what exactly is a kidney stone, and how do people get them? A kidney stone is a solid, irregularly shaped object made from chemicals in the urine. A kidney stone can be as small as a grain of rice, or, shockingly, as large as a golf ball. Your urine contains various waste substances, including calcium, oxalate, and uric acid. Kidney stones are formed when the urine has a higher than normal concentration of these minerals and substances, which can stick together to form a tiny hard crystal. This solid mass will continue to grow unless it is passed out of the body with the urine. After the kidney stone has formed, it will either stay in the kidney or travel down the urinary tract into the ureter. Sometimes kidney stones pass out of the body without causing any pain, or without you even knowing they've passed. But in other cases, if the stone gets stuck, it can cause a backup of urine and extreme pain. There are 4 different types of kidney stones made up of different substances: calcium oxalate, uric acid, struvite, and cystine. Factors that cause and increase your risk of kidney stones. Kidney stones generally have no single cause, and numerous factors may increase your risk of getting them. Some of these factors include insufficient hydration. Your body needs to produce enough urine to dilute the substances that can form kidney stones. If you don't drink enough water or you sweat too much, your urine is probably a dark color. It should be nearly clear or pale yellow. You should produce about 8 cups of urine a day, so aim to drink about 10 cups of water daily. Every now and then, swap a glass of water for a citrus drink. The citrate in orange juice or lemonade is known to potentially block kidney stones from forming. Diet. What you eat plays a significant role in determining whether you get one of these nasty stones or not. The most common kind of kidney stone occurs when calcium and oxalate stick together while your kidneys produce urine. Oxalate is a chemical in many healthy foods and vegetables, so your doctor may tell you to reduce high oxalate foods if you've had this kind of kidney stone before. Examples of high oxalate foods include spinach, rhubarb, grits, and bran cereal. You may have also heard that drinking milk can cause kidney stones. However, this is not true. If you consume calcium-rich foods like milk and cheese, and foods with oxalate simultaneously, it helps your body process the oxalate. This is because the calcium and oxalate bind in the gut instead of the kidneys, where stones form. Sodium, which you mainly get through table salt, can raise your chances of getting several kinds of kidney stones. Watch out for salty snacks, packaged meats, canned foods, and other processed substances, as they can increase your chances of getting kidney stones. Animal protein can also increase the risk of kidney stones. One type of kidney stone forms when your urine is too acidic, and red meat and shellfish can make the uric acid level in your body rise. This uric acid collects in the joints and causes gout, or moves to your kidneys and forms a stone. More importantly, animal protein raises the calcium level in your urine and lowers the amount of citrate in your body, which can trigger the formation of kidney stones. Gut problems. Kidney stones are the most common kidney problem in people with inflammatory bowel diseases like ulcerative colitis and Crohn's disease. Bowel problems can cause diarrhea, so you produce less urine. Your body may also absorb extra oxalate from the intestines, so more gets in your urine. Medical conditions. Certain genetic diseases carry a higher risk of kidney stones. One example is a congenital disability known as medullary sponge kidney, which causes cysts to form in the kidneys. Another disease is type 2 diabetes, which can make your urine more acidic, encouraging kidney stones. Gout is another condition that makes uric acid build up in the blood and form crystals in the kidneys and joints, resulting in large and painful kidney stones. Hyperparathyroidism causes your parathyroid glands to pump out too many hormones, which raises calcium levels in the blood and urine and causes kidney stones. Renal tubular acidosis is a kidney problem that causes too much acid to build up in the body, which can also lead to kidney stone formation. Medications. Some medications that can cause kidney stones include certain antibiotics, such as ciprofloxacin and sulfur antibiotics, certain drugs that treat HIV and AIDS, and certain diuretics used to treat high blood pressure. What are the symptoms of kidney stones? Some kidney stones are as small as a grain of sand. Others are as large as a pebble, and some can even be as big as a golf ball. As a general rule, the larger the kidney stone, the more obvious the symptoms. Symptoms may include one or more of the following: severe pain on either side of the lower back, more vague pain or stomachache that doesn't go away, blood in the urine, fever and chills, nausea or vomiting, urine that smells bad or looks cloudy. Kidney stones begin to cause pain when they create a blockage, which can rapidly build up to severe pain. In most instances, kidney stones pass without causing damage, but usually not without causing pain. Pain-relieving medication may be the only treatment needed for small kidney stones. However, in serious cases, surgery may be necessary. How are kidney stones treated? Kidney stone treatment is dependent on the type of stone. One common solution for small stones is drinking 8 to 10 glasses of water a day to increase urine flow, to allow the stone to pass on its own. The amount of time it takes to pass a kidney stone varies depending on the size of the stone. Generally, small stones can pass through the urine within 1 to 2 weeks, and often without treatment. On the other hand, larger kidney stones may take 2 to 3 weeks to move through the kidneys and into the bladder. Kidney stones that don't pass on their own within 4 weeks usually require medical treatment. Other treatment options include medication for pain relief. The presence of infection may also require treatment with antibiotics. Other medications for kidney stones include xyloprim for uric acid stones, phosphorus solutions to prevent calcium stones from forming, sodium citrate or sodium bicarbonate to make the urine less acidic, thiazide diuretics to prevent calcium stones from forming, Advil, Aleve or Tylenol for pain, lithotripsy. This treatment method uses sound waves to break up large kidney stones so they can pass down the ureter into your bladder more easily. Lithotripsy can be unpleasant and may require general anesthesia. It can cause bruising on the back and the abdomen and bleeding around the kidney and nearby organs. Tunnel surgery. This is a treatment method where the surgeon removes the stones through a small incision in your back. This procedure might be needed in the following situations. The kidney stone causes an obstruction, an infection, or is damaging the kidneys. The kidney stone has grown too big to pass through the body. The pain cannot be managed through medication. Uteroscopy. When a kidney stone is stuck in the ureter or bladder, the doctor may use an instrument called a ureteroscope to remove it. A ureteroscope is a tiny wire with a camera attached that is inserted into the urethra and passed into the bladder. The doctor then uses a small cage to snag the kidney stone and remove it. A kidney stone can be a frustrating and rather painful issue to deal with. However, various treatment options are available if you do happen to encounter one. Numerous medications and procedures can help you manage the symptoms and encourage the passing of kidney stones. In addition, staying well hydrated and making healthy changes to your diet can prevent kidney stones from forming in the first place.